Hi everyone, this is Calum from the UNDP Global Centre for Tech, Innovation and Sustainable Development. Thank you all for joining us today. Hopefully you can see my screen. Just to let you know, we're recording this session and we'll share the link after this call, so you can share it with your partners, and we'll also look to upload it to our website as well. So for the next 20 or so minutes, I'm going to walk you through our COVID-19 response and recovery open source digital toolkit. I'll walk you through each of the tools that we have available in the toolkit, and then at the end leave a little bit of time for Q&A, and happy to open up to any kind of question that you're looking at around implementation, usage of the tool, or usage of any of the tools, or any other wider questions. So thank you again all for joining. So just to recap, open source software is where the underlying code of a piece of software or other solution is made freely available. This allows people to reuse it, to change it, to apply it to their own context, or to combine it with other solutions. An example of this more broadly is something like WordPress. By contrast, closed source software is code that is proprietary, so it's owned or managed by an organization, and where licensing can limit or even prevent any form of modification or adaptation. This is often seen in more commercial solutions, so things like Microsoft Word or Adobe Photoshop. Just to flag though, that neither open nor closed source is inherently good or inherently bad. Both have their uses and both have their limitations, even open source. However, in the context of COVID-19 response and recovery, we've seen particular value in open source software. We've seen accelerate kind of national digital development, reduce duplication, and also allow countries to build on established best practice. That said, there are a few things to keep in mind. First, any tool, whether closed or open source, will require technical support at some point. Commercial solutions can have an advantage here, as companies are often incentivized to provide support in order to raise revenue or to kind of get return on investment from their development. However, for open source software, support is often provided by free online communities, often in their own time, or by limited pools of consultants. Both models can work. Some commercial tools, stop providing support quickly, while some open source communities have flourished for many, many years. But it's something important to note, particularly in the context of ensuring that any implemented solutions are sustainable. Finally, on a broader point, as often as open source software is open, this means that the code can be viewed by the whole community to ensure that it's safe and secure. However, this demands that the code is also kept up to date. So again, you're relying on the goodwill and the time and the effort of often volunteers to keep this current. Sometimes open source communities aren't able to make software updates as quickly as commercial developers. So it's very important to ensure that any software, any implementation, you're working with developers more widely to ensure that going forward, it's private, it's secure, and so on. More broadly as well, open source software can sometimes be a little bit complex because the solutions tend to be a bit broader. So can sometimes require a little bit of adjustment to meet local contexts and to solve local problems. So before jumping into the walkthrough of each of the tools, I just want to highlight how the UNDP Global Centre can support country offices, national governments, and other partners in implementing these tools or exploring digitalisation in the context of COVID-19 more broadly. First, we're able to provide technical advice and guidance, or source others who can expand upon the support we can offer. We've explored, implemented, or engaged with many of the tools that I'm about to walk through. Second, we can broker partnerships, including with the developers or wider support community for some of these tools, and this includes drawing on our technical expertise to shape your terms of engagement with any of these partners. More broadly, we're also positioned to support you all beyond each of these tools. For example, in the context of digital strategy, through shaping things like digital needs assessments, digital roadmaps, strategies, technical work such as user experience design, but also wider policies that are key for COVID-19 response and recovery, things like big data, digital identity, digital inclusion, connectivity, and others. And I'll come back to this towards the end of this session. So moving to the toolkit itself, the toolkit is split into 4 focus areas. There's more than 20 tools now available, and we should be adding another 5 to 10 in the next few days. This number is growing every week though. These tools have been proven and applied in more than 50 countries, including following other public health and communicable disease crises, such as the Ebola outbreak a few years ago. These tools have also been built, supported, or funded by some of the biggest names in international development. Amongst them, the tools represent more than $100 million worth of development and implementation costs. And more broadly, they've saved lives and reduced inefficiencies through accelerating digital transformation across all aspects of societies, economies, and the public sector. So I'm going to walk you all through the 4 focus areas of the tools, and then highlight a few tools that demonstrate the kind of wide applicability of the toolkit and its solutions. Many of these tools have been adapted also to the unique challenges of COVID-19 response and recovery. And as I mentioned at the outset, although all these tools are available on the toolkit now and available for free and immediate deployment, they will likely need some customization for local contexts and needs, but we can play a really important role in shaping how these are implemented in partnership with all of you. So the first category is disease monitoring. So this is about using digital and open source to identify the spread of COVID-19 in the society. And all these tools, again, have been proven in many countries. And the first is IHRIS, which allows ministries of health to manage their health resources. And this is everything from managing, accrediting, recruiting, and training healthcare workers. And this is used in many countries around the world, particularly in a lower income setting. OpenMRS is the main patient care system used in many countries. Currently, it houses more than 12 million patient medical records, and these are used for healthcare delivery, but also kind of wider purposes, such as healthcare research as well. Toolkit is developed by an organization called Flowminder, who some of you may have come across before. Flowminder have done extensive work on using mobile operator data to explore things such as disease spread and epidemiology more broadly. Toolkit is a toolkit that can be implemented in partnership with a mobile operator, and it enables analysis of mobile network data without sacrificing user privacy. Moving to the next, OpenSRP. So SRP stands for Smart Register Platform. And this is about supporting healthcare workers to monitor and also support their patients. For example, keeping in touch with their patients, flagging danger signs to ensure prompt referrals, and also keeping track of the healthcare journey of patients. So when they're visiting clinics, when they may have missed appointments, when they're due for vaccinations, and so on. The Tokyo Metropolitan Government resource we have on the toolkit is a quite extensive front-end dashboard that has been crucial to citizen response in Tokyo. It allows collation of all key local statistics, can be customized for other contexts, and also allows a kind of one-stop shop for policymakers and citizens to understand the spread and the response of governments to COVID. The COVID Care Map is being used across the US to visualize data in order to drive resource utilization. So it features open source methods, the code to visualize and process data, and also other resources to provide decision makers with the insights needed to deploy healthcare resources. The team there are particularly interested in expanding this to other geographies, so happy to facilitate connections there as well. And then the final one on the right there is PicoBar, and this is used across West Java in a similar way to the Tokyo platform to signpost citizens to resources, to provide information on COVID, and also to support policymakers in their response as well. So moving to prevention and containment, this is about how to use digital and open source to prevent the spread of disease and also support efforts to minimize further spread. SORMAS is an end-to-end disease monitoring system, everything from disease detection notifications when diseases are seen, through to facilitating patient follow-up and adherence to solution and other treatment protocols. ODK, is something that many of you may be familiar with, is a globally proven data collection and analytical toolkit. It allows you to collect data on patients, citizens, or anyone else through online and offline mobile apps. This is also a good example of a tool that is particularly relevant for response and recovery. ODK is used in many international development programs and projects to engage more with beneficiaries to understand what their needs and realities are. And then finally here on this slide is the Community Health Toolkit. This is a suite of products founded on the kind of core open source framework, which has been built to function on web, app, and on offline, also with a number of translations for many global languages. And then the final ones here on the prevention and containment side are mHero. This is a two-way mobile phone communication platform, allowing ministries of health or others to keep in touch with healthcare workers. For example, allowing kind of real-time interaction with workers checking out they have suitable resources, that they know where they're going, who they're speaking to, and so on. And this has also been proven in the Ebola response a few years ago. OpenLMIS is a logistics management information system. It allows you to manage healthcare supply chains, for example, ensuring that healthcare facilities have the resources needed to serve the public in the context of COVID and more broadly. And then Futuregov is a UK-based digital consultancy, and they've worked with a number of local authorities on COVID-19 response. The reason we feature them here is they've produced a really exciting out-of-the-box website front end, which they've made completely free, freely available and open source to allow councils and other local authorities to signpost residents to public services using maps and similar. It can be customized for any context, so it's a really useful tool to apply. And then apologies, two more here. Health Sites builds on the open source mapping community work, and it's all about identifying all healthcare facilities in the country, mapping these and making the data available to solution providers and response partners as well. It's a really crucial tool for governments and others in driving response to crises such as COVID, as you need to understand obviously where your healthcare sites are and the status and so on. And then finally here, Open HIM is a bit more technical, but it essentially allows different healthcare information systems or components to kind of talk to each other. It's almost a kind of API system for a number of different healthcare systems. It's particularly worth flagging to healthcare ministries or similar, as there's a lot of existing APIs provided on the website, almost a kind of catalog of different interactions and interfaces that can be used very quickly. And now moving to diagnosis. This is obviously all about how open source and digital can help citizens, governments, and other partners to confirm whether individuals are infected by COVID or other diseases or not. Some of these may be quite familiar to you with obviously recent press and so on. So the first is the BlueTrace protocol, and this is the Bluetooth contact tracing technology developed by the Singaporean government, and it's now being used or has been modified for a number of other contact tracing applications around the world. OpenELIS is a really exciting bit of software that supports the back end of laboratory laboratory systems. So for example, if you're processing tests around COVID or other diseases, the back end of the laboratory will be founded on something like OpenELIS. And then PCMT stands for the Product Catalog Management Tool. It's one of the more specific tools in the toolkit. And again, it's used to kind of standardize each product in a healthcare supply chain using terminology that's applied globally so that you can have end-to-end management and visibility on your health supplies from supply through to usage on the ground as well. And then finally on diagnosis, we have a few more contact tracing apps. The first is the one from the UK, the NHS COVID-19 app. Again, this uses Bluetooth. It's been tested at scale on the Isle of Wight in the UK, although recently it was shelved by the government in the interest of going with the solution that may be developed by Apple and Google. However, the code is still available for people to use and develop as needed. OpenIMIS is about providing a healthcare financing platform for governments, healthcare facilities, and others. And what's particularly interesting about this is it's an end-to-end solution. So it does everything from processing patient treatment claims through to enabling payments and healthcare reporting as well. And then COVID Safe on the right there is another contact tracing app developed by the University of Washington and some volunteers from Microsoft with privacy at the heart of that approach. And then finally, just moving to the recovery section. So open source and digital can play a crucial role in supporting governments and societies in recovering from COVID-19. The tools here have quite a wide range in focus, and it's also where we're adding more and more tools every week because obviously as COVID recovery becomes clearer. The first there is RapidPro. This is a very powerful tool for building communications products such as chatbots, SMS, or other interactions or interfaces. It's also platform agnostic, so it can be used with channels such as WhatsApp, Facebook, and others. OpenCRVS is used in several countries to ensure that civil registration, so the counting of all births, deaths, and other foundational data, is happening and that it's digitized. These components are essential in public service delivery. If you're not counted, you don't count. And then X-Road is something that I'm sure several of you are familiar with. This is a foundational data infrastructure that was originally developed by the Estonian government. It's now been applied in a number of other countries as well. As digitalization is likely to be a key component of COVID-19 recovery, it's essential that governments have a robust and effective data and governance infrastructure. And then finally on the recovery section, and then I'll quickly wrap up and open up to questions. The first is Rapid SMS. Again, another tool originally developed by UNICEF, and this is about providing SMS, so text message services for data collection and other processes. It's been used in many countries, often reflecting that SMS is still a very popular and accessible communication method in many lower income settings. The second one there doesn't have a useful logo, but it's called Beeline. This was developed by the Singaporean government to crowdsource public transport routes. So in the context of shifting transport usage, particularly with COVID-19, how it's shifted where we're living, where we're working, and how we're living, it could be particularly useful in many countries. It's no longer used by Singapore, but the code is still available and had quite a significant impact here locally. Ushahidi, again, is another tool that some of you may be very familiar with. It was originally used to track election violence. It's now a hugely useful tool for citizen engagement. So if you're developing policies, exploring other interventions, it's a great way to engage citizens to understand what they're looking for. And then finally here, Notify, well, gov.uk Notify is a tool built by the UK Government Digital Service to send citizens notifications linked to public service delivery. And this is everything from SMS reminders to complete tax returns, through to emails to update on the progress of service engagement. It's similarly important in the kind of context of digital public service delivery that we're looking to shift to with COVID-19 recovery. So with more than 20 tools now available, this number is growing every week, and we'll probably have another 10 tools available in the next week or so. These will likely have a focus on e-government services, for example, open data platforms. And again, just to revisit, these are the 3 areas that we're able to provide support on in terms of taking some of these tools forward. So technical advice, partnership brokering, and digital strategy. And these are all areas that I'll pick up in the questions shortly. Just to wrap up, in the context of COVID-19 and beyond the toolkit, we'll see that digitalization is a really central aspect of both COVID-19 response and also likely to be an important element of COVID-19 recovery as well. This is the first time we're sharing this graphic and the discussion more broadly, and we're keen to have a more detailed strategy coming soon. What we're seeing as a role of digitalization includes building the underlying connectivity to shift to remote working, drive healthcare, and so on, but also open data to catalyze the private sector and make tools like chatbots and others I've discussed feasible. So underlying all of these as well are the policies and processes needed to ensure that digitalization is inclusive and useful. Things like agile procurement and a focus on ethics, but also safety and security. In the context of this new normal, we also need to be mindful of developing crisis. We need to be building good solutions regardless of pace, and also thinking about sustainability and relevance from the outset. This is why we think open source is particularly relevant here, as many of these tools have been applied in a number of contexts around the world. Similarly, digital and technology aren't a panacea. They're tools, and often a complement to existing or other processes. Interestingly, even the developers of the Trace Together app, the one I just mentioned in Singapore, the Blue Trace protocol, have been very clear and very publicly that it should not be a replacement for in-person contact tracing efforts. So all of our work on technology and innovation should amplify or augment existing work. It's not a replacement by any stretch. So we're very keen to work with all of you on applying digitalization and open source in a useful, sustainable, and inclusive way. So with that in mind, a very quick call to action here. There's a link to the toolkit, and we'll share this after this session as well. My email address is on the screen, and again, this is something we'll share in email afterward. And as I mentioned at the outset, we've also recorded this webinar so you can share it with other partners, governments, civil society organizations, and others in your network to start taking this work forward as well. And we'd be very keen to support all of you in doing so. So thank you all for your time. I appreciate it's quite a rush through of quite a lot of tools there, but more than happy to have a more detailed chat now in the Q&A. Thank you.
Thank you, Calum. Thanks very much for doing this. Hi, everyone. This is Phil. I'm also from the UNDP Global Centre Singapore. And we thought that this would be a great opportunity for everyone to get a bit more of a more detailed advice on how to actually use these tools, especially since there are quite a few of them and the categories may not always be very clear, or at least it may not be super clear how the tools can help you just from the category names alone. So I encourage you to put your questions into the chat function now, and I see that there are a few coming in. So, Calum, you ready to answer some questions?
Yeah, definitely.
All right. Okay, so there are a couple of questions coming in. Firstly, do we review the toolkit ourselves, or can we have an initial chat with your center regarding the needs of our government? Can you recommend which ones are the most relevant, and then can we demo them with the government?
That's a really, really good point. So what we'd look to do is we are more than happy to have a discussion about your digitalization plans, the problems that you're looking to solve. And we can obviously recommend tools that could meet those requirements, and then also have a broader chat with you and your government partners about how you go forward with implementing those as well. So yeah, very happy to have that kind of initial chat, understand more your kind of needs and your priorities, and then go from there.
Okay, and on that note, actually, Calum, would you like to share a bit more about how we worked with the Mauritius government? Because so far that's been one of the most interesting case studies that have come through from the toolkit.
Definitely. So, as Phil mentioned there, we worked with our UNDP country office in Mauritius, and they found a tool on our website, actually Open Ellis, the one I mentioned around laboratory information systems. The Ministry of Health and IT found it on the site. We're very keen to learn more about it. So we spent a bit of time with the country office in Mauritius explaining more about the tool, and then eventually kind of connected them with the developers behind the tool, who are based at the University of Washington. We then provide a little bit of further support about how to define that collaboration, and then now moving forward with scaling that solution up as well. So as Phil mentioned, very keen to be involved at any stage of this as well. So please do just get in touch.
Thanks, Calum. We also want to take a bit of a step back and look at open source technology as a whole. I know you had a great short introduction earlier, but perhaps we could also sort of unpack that a little bit more, and just share how open source has been making really great strides and helping international development around the world, especially around the cost effectiveness and the speed, the iterations, and so on.
Yeah, definitely. So the big value of open source is a lot of these tools have been proven and developed already. So it means that countries, government institutions, or other partners can very quickly take a tool that's been proven in another context and then apply it or tweak it to meet their local needs. And this means instead of starting from scratch, they can start much further down that development pathway, which is particularly important in a time of crisis, and particularly important in contexts where you may have limited developer time or limited resources more broadly. So that's one of the big values that we've seen. The second is that a lot of these tools have had huge amounts of investment go into them. Just a handful of them have had more than $100 million worth of development time, and this is a huge amount of investment that any individual country or country office would not be able to do themselves. So actually piggybacking on the efforts that have gone already can be hugely important here in terms of building on best practice.
Fantastic. And just looking ahead, just beyond the whole COVID-19 situation, what are some of the other situations in which obviously time is of the essence, and you need to build something really quickly, and you may not have the right infrastructure, but open source tech can be the answer. Are there any other scenarios that you can share?
Yeah, definitely. I think this just also speaks to the question that just came in. So the reason we're increasingly adding tools in the context of COVID recovery is that digitalization is likely to play a really important role in that. And that's going to be things like e-learning, e-collaboration. So how do we do remote working? How do we facilitate collaboration virtually? And so a lot of open source tools actually speak to this as well. So for example, in the context of e-learning, things like Moodle, edX, and others are open source. E-collaboration, there's a number of tools that we'll be publishing in the next week or so that are relevant here. Particularly if you're looking at digital public service delivery and digital government more broadly, there's a lot that open source can offer in that context as well. So very much moving beyond just COVID and looking more broadly too.
Fantastic. Thanks, Shivani, for that great question. And also, Calum, would you like to speak more also about the data privacy piece in all of this?
Definitely. So really, really good question. And I touched upon it very briefly at the start, but just conscious that we didn't have much time today to really unpack it. Data privacy is a huge and should be a central consideration of anything you're doing with technology, digital or data. there is no best practice, either good open source or closed source here. Both can be very good with data privacy, both can be very bad. It all comes down to implementation and your accountability and governance mechanisms. So making sure that these tools are implemented well, like you're keeping code current, so you're checking for bugs, you're working with developers to make sure that your software is the latest version, whether open or closed source, and then ensuring that you have the accountability measures locally to make sure that if data privacy is breached, then people are protected accordingly. The advantage for open source sometimes is that because the code is open source, it means that everyone is able to look at it, so any vulnerabilities can be found very quickly. However, this all relies on people having time and effort to look at it. And sometimes because open source is something done by volunteers and others who aren't paid, it means that vulnerabilities sometimes aren't found as quickly as they may be with commercial software. However, with all the kind of open source tools we've mentioned here, many of them have huge and very active developer communities who are very good at identifying issues and fixing them very quickly. And also there's a number of commercial paid for solutions that have had very serious data breaches over the past few years. So there's no good or bad, whether open or closed source. It's all about how you implement it and making sure that you're accountable and you have the governance processes in place to make sure it's implemented and managed well.
Thanks, Calum. Do we have time for maybe one more question?
Yeah, definitely.
Okay, so I think the last one really is, can you just share which countries some of these tools have been implemented in, and what other protocols or frameworks have they been implemented along with this? I think you touched a bit earlier. Maybe we can elaborate a bit further?
Yeah, definitely. So all of these tools have been applied in many different cities and countries, largely in lower and middle income settings. So globally across Sub-Saharan Africa, Asia Pacific, Latin America, and across all of them represent probably more than 100 or so countries. What you probably heard as I walked through some of these tools as well, some are very, very specific. So something like the product catalog management tool, PCMT, is very, very applied about managing your healthcare supply chains, where something like Rapid Pro or ODK is about building chatbots or data collection, so much more widely applicable. So some of them can stand alone, others are designed to be implemented in a kind of wider system or framework. And I think this goes back to the very first question. We'd be delighted as a centre to work with you all to understand actually how you can fit these tools into either your existing workflows and frameworks, or how you can figure out how you start afresh as kind of a part of a wider digitalisation strategy. So please do drop us a line on that as well.
Thanks, Calum. So those were all the questions that were in the chat, and if there's any more, just put them into the chat right now. Otherwise, I think we can wrap up in the next couple minutes. Do you want to wait a couple minutes more, Calum, or are we good?
Yeah, I'm happy to wait for a few minutes. Thank you all for your time. Please do get in touch if you have any questions or you want to work with us on any of these tools. We'll get in touch with you all after this and share the webinar recording. We'll cut out the Q&A, but please do share the main content with any of your partners. And we'll also upload it to our website as well. But happy to hang around here for a little bit longer if there's any more questions coming in.
So,
but no pressure if you have any questions.
Okay, so maybe I don't see any more questions coming in, but just like Calum said, we'll be sharing all of this, all of the slides with you and the recording, and we'll also be transcribing this half-hour session so that you can zero in on the bits that you really need, and we will be sending, we'll be hyperlinking to all of the tools for your easy reference. We also have a catalog in a PDF of all the different tools. I hope that would be more helpful for you to peruse them. So thank you so much, everyone, for joining us. And good morning, afternoon, and evening, wherever you are. Thanks, Calum, for a fantastic presentation. Thanks, everyone, for joining us. Oh, hang on.
Oh, no, thank you, everyone.
Oh, okay. So there's thanks coming in, not more questions. Okay. Thanks very much, guys.
Thank you, guys. Take care.
All right. Bye, everyone.